Gentlewoman from Florida, Ms. Castor.
Chairman Pallone, thank you very much for convening this timely hearing to address the discussion draft and that will reauthorize the Ryan White initiative. I look forward to the expert testimony today. We must act expeditiously because we are facing sunset, and so many of our neighbors living with HIV and AIDS are depending on us. In my home state of Florida, the Ryan White initiative has prolonged the lives of many men and women affected by this devastating disease. In 2004, Ryan White assisted well over 100,000 patients and nearly 13,000 family members of people living with HIV and AIDS. And those numbers, unfortunately, continue to rise. The stories of the impact that the Ryan White initiative has had on my neighbors exemplify the strength of human nature to persevere and to meet adversity head-on. And I'd like to share with you two short stories from back home in Florida, stories that display the life-changing impact that Ryan White has had on many lives. Christopher from Florida says, I was diagnosed with HIV back in the summer of 2000, and I was fresh out of college with no health insurance. It was only through government-assisted programs that were funded largely by the Ryan White Initiative that I was able to have checkups and blood work done. I was a patient at Pinellas Care Clinic in St. Petersburg, Florida. I have since begun working and have had insurance for 4 years, but could not have gotten through those 5 years without the assistance of the Ryan White Initiative. Mary from Florida relayed to me, I have lived with HIV/AIDS since 1990. When I became ill in December 2008, I had to leave my part-time job. With co-payments on medications and medical visits, I was at the point of choosing to eat or stop taking medical services. After contacting a Ryan White case management agency, I was helped out with financial assistance. I can honestly say if Ryan White had not been in place, I believe I would be dead. There are many like myself here in the United States who need just a little help to continue to be productive members of society. Mr. Chairman, the Ryan White Initiative is the only true lifeline for many people living with HIV/AIDS, many of whom are oftentimes barred from private health insurance. So I strongly urge the committee to move quickly to update and reauthorize Ryan White before the September 30th sunset date. I yield back my time.
Thank you.